An especially bitter winter in the Northern Hemisphere has been making living on the streets even tougher. And crowded shelters aren't the safest place to spend the night, with the pandemic still raging. It's not just the cold the homeless have to contend with. COVID-19 poses a special danger for a group likely to have other health problems too. Now, with many hotels empty due to the crisis, some cities have found a clever way to bring a vulnerable population in from the cold. Well, many European capitals adopted this strategy during the first wave. Germany's taken longer, but hotels in Berlin at least opened their doors in time for the big chill. And with tourists staying away, it's helping keep business going, thanks to the homeless. DW's Tessa Walter reports.
When icy rains hit Berlin, some have it harder to find shelter than others. But this man got lucky this year. Christian, who doesn't want to give his full name, normally sleeps in an emergency shelter during winter. Now he puts the few things he owns inside a hotel room. Here, Christian feels safe and he can take a shower. He also gets served warm food, a real upgrade, he finds.
Ich habe geschlafen im Container.
I used to sleep in a container. This is a hotel. That's much better.
Pension, sag mal so. Und ist viel besser als da drüber.
The Hotel Reiter is one of several hotels in Berlin which are now welcoming homeless people like Christian. It is a win-win situation. He has a place to sleep and take shelter from the cold, while the hotel can make some money. The city pays for the accommodation. The beds were urgently needed, explains organizer Wolfgang Wilsch. Due to the COVID crisis, shelters had to reduce the number of beds to keep up hygiene measures. The shelter usually puts people in dormitories or even on camping mats in big shared rooms. We can't do that because of COVID. We are very grateful that we can use the hotel because we can put people in twin rooms. It means we never have more than 2 or 3 people in a room. And there is more. The guests can return to their beds all winter long if they stick to the rules. That makes all the difference, says Marta, who helps run the place and has a close connection to many of them.
When
they get here, they're unwashed and exhausted, often depressed and lacking prospects. After a few weeks here, they have changed completely. They have a different outlook on the future. Some of them find work, some even a home of their own. Something better, anyway. Living in his own home, that is also Christian's dream. He is hopeful of realizing it once the COVID crisis is over.
Freek Spennewen is from the European Federation of National Organisations working with the homeless. How can others be helped to permanent housing during this crisis? And even more importantly, once it's over and hotel rooms are no longer on offer?
Well, I think what we have to, let me first say that it's important that most member states in the European Union have done an effort to get people off the streets into hotels. What is important is that we start thinking already about the post-corona period. You don't want to, these homeless people, I mean, we're talking about 10,000s of homeless people in hotels. We don't want them to be pushed back into the shelter or even worse, onto the street. So we have to make sure that they move into supported housing as much as possible. So I think that's a really important commitment that we have to get from policymakers at local, at national level.
What about using this opportunity to test a part of the population that may not otherwise go see a doctor?
Well, yes, of course, homeless people are more vulnerable to COVID than the general population, so they should be a priority. They should be a priority group when it comes to testing. Unfortunately, what we see in most countries that they are not a priority group. There is only a handful of countries, including Germany, where the homeless population and the professionals working with them are a priority group that will be tested and vaccinated quite soon. So I think it's important to learn from that and to push the testing and vaccination in the homeless sector as much as possible.
Are they more prone to COVID, though? I've heard of reports of them having a higher dose of vitamin D simply because they're outdoors so much more. And also, they're quite socially distanced from the rest of us.
Well, I think they are more vulnerable. Like there is a lot of pre-existing conditions that make them more vulnerable.
Okay.
But also don't think that all homeless people are outside the whole time. Most of the homeless people are actually in shelter, in longer-term shelter. So anyway, their health is really quite bad in general. So there is no doubt that they are more vulnerable to the COVID infection than the general population. And also the social distancing is really difficult. Like if you live in a shelter, most shelters are overcrowded. So I think it would be wrong to suggest that it's easier for homeless people to socially distance.
Is it also a fact that homelessness is increasing at the moment with so many people losing their jobs?
Yes, but homeless people was increasing pre-corona crisis. Between 2009 and 2019, we have seen in the European Union a 70 increase in the number of people that experience homelessness on any given day, which means are sleeping on the streets, are sleeping rough or in a shelter. So there was a rapid increase pre-corona crisis. It's difficult to say if homelessness is further increasing, but we estimate, like we think that it's further increasing. And what we're especially concerned about is how the evictions will evolve. At the moment, most member states have eviction moratoria in place. They will not last forever. There is increasing pressure to lift this moratoria. That will inevitably lead to a spike in evictions, and we're afraid that this spike in eviction will also translate in a spike in homelessness. So we'll probably see, we've seen an increase before Corona, we'll probably see an increase after Corona as well.
What about the Housing First initiative? Is that making a difference in some countries? Instead of makeshift healthcare and psychological support, the homeless get an apartment without conditions attached?
Yes, well, there is a lot of evidence that Housing First works. It works especially for homeless people with complex needs and homeless people that are chronically homeless. So I don't think that we have to further doubt about its effectiveness. The scientific evidence is there. What we need to do now is to promote the scientific evidence and help convince policymakers at local and national level to bring Housing First to scale. I'm not trying to argue that the traditional way of addressing homelessness by making homeless people pass through a shelter, through the shelter system, is totally ineffective. But it's very clear that Housing First is more effective. People keep their housing, people feel better, and also in other areas people are doing better. So there is no doubt that Housing First works, especially for chronically homeless people.
Freek Spinnewijn from the European Federation of National Organizations Working with the Homeless, thank you very much.
Thank you. Good afternoon.
Time to hand you over to our science correspondent, Derek Williams. He's been looking into your questions on the coronavirus.
Are COVID-19 survivors like me protected to some extent from reinfection with the new variants?
The answer to this worrisome question is still up in the air, but it's clearly something authorities will be keeping a close eye on in the coming months. What makes things complicated is that the pandemic landscape is shifting so rapidly. We're trying to track the effects of vaccines and multiple variants across societies, but even nailing down exactly which variant might have affected someone somewhere is still much more the exception than the rule. Even in the UK, which does a better job of tracking this kind of data than any other country, they've only sequenced viral genomes from around 10% of all infected patients, which means we only know in 1 out of about 10 cases which variant a British patient had. And in most other countries, we know a whole lot less than that. One thing that's fueled concerns about the possibility of survivors being reinfected with new variants is some results from a recent vaccine trial in South Africa. although it was set up to provide information about the safety and efficacy of the vaccine, the trial incidentally revealed something kind of frightening. In the placebo group, subjects who had antibodies indicating that they'd already had COVID-19 once seemed just as likely to contract the disease again in the course of the study as people who hadn't had it. One possible explanation for that is that the variant discovered in South Africa is less likely to be prevented by naturally occurring immunity to earlier variants. But that still hasn't been proven. And the data set was too small to draw firm conclusions. The upside, however, is that even if reinfection with a new variant does occur, many experts think that one run-in with the disease should generally continue to provide some protection, maybe enough to prevent severe disease with a newer variant. That's the hope, at least.